After studying this module, you will be able to know more about the constructs of optimism and pessimism, identify the various theories of optimism, and learn about the benefits of optimism in various domains. Optimism and pessimism refer to the positive and negative predictions that people make regarding their future. Some people look usually on the bright side of the events, while others look on the darker side. Therefore, it can be said that optimists expect good things to happen to them, while pessimists expect bad things to happen to them. Many studies have provided evidence for the optimistic bias. The concept of optimism and pessimism are related to people's expectations for the future. These concepts have linkages to the expectancy value theories of motivation. Expectancy value theories start with the assumption that behavior is centered on the pursuit of goals. Goals are the states or the ends that people view as either desirable or undesirable. The more important is the goal to someone, the greater is its value for that person. Now, the second conceptual element in expectancy value theories is expectancy, which is a sense of confidence or doubt about the attainability of the goal. Only if people have enough confidence that they can make efforts to achieve these goals, then only they will make these efforts. So two things. One thing is that what is the value of the goal, and second thing is that how confident you are that you will be able to work for achieving that particular goal in that required direction. Expectancy based theories generally suggest that behavior is predicted best when the level of the expectancy fits that of the behavior that is being predicted. It's argued that prediction is best when one takes into account several levels of specificity regarding the behavior. However, there are many outcomes in life which have multiple causes. In such situations, generalized expectations are very useful in predicting the behavior of the people. From these principles, many predictions can be made about the optimists and the pessimists. When confronting a challenge, optimists are more confident and more persistent. Pessimists, in contrast, are more doubtful and therefore hesitant. In adverse cases, this difference is more exaggerated, whereas optimistic believe diversity can be handled successfully, pessimists expect disaster. This can lead to differences in actions related to taking health risks, taking precautions in risky situations, and being persistent in one's efforts to overcome health threats or the daily routine threats and the challenges. It can also lead to differences in terms of coping responses people use when confronting a threat. Optimism has been linked to positive mood, good morale, perseverance, effective problem solving, academic, athletic, occupational, and political success, as well as the popularity and the good health. Pessimism, in contrast, has been found to be linked to depression, passivity, failure, social isolation, morbidity, and of course the mortality. Optimism and subjective well-being. When people confront difficult circumstances, they experience a variety of emotions like anger, anxiety, frustration, depression, tension, etc. The balance among these feelings relates to people's degree of optimism or pessimism. Since optimists are the people who expect to have positive outcomes, they experience relatively more positive feelings. Pessimists, just because they expect that the negative outcomes are going to be there, automatically they have a greater tendency towards negative feelings of anxiety, guilt, anger, and sadness, etc. Relationships between optimism and distress have been examined in diverse groups of people facing adversity. The researchers have also examined the experiences of people dealing with children, abortion, coronary artery bypass surgery, bone marrow transplantation, the diagnosis of cancer, and the progression of AIDS, etc. All these studies show that pessimists experienced more distress after the event than did the optimists. Scheer and colleagues have examined men undergoing and recovering from coronary artery bypass surgeries. A week later, optimists reported more happiness and relief, more satisfaction with their medical care, and more satisfaction with the emotional support from their friends. 6 months after surgery, optimists reported higher quality of life than the pessimists. In a follow up, 5 years after surgery, optimists continued to experience greater subjective well being and better quality of life as compared to the pessimists. Optimists also have been studied in the context of other kinds of health crises. In a study on adjustment to treatment for early stage breast cancer, optimism not only predicted the lower initial distress but also the resilience against distress during the year following surgery. So, you see, if you are optimistic, you can deal much better with the diseases you may suffer from. Higher levels of optimism upon entering college predicted lower levels of psychological distress at the end of the semester. The reasoning behind the studies is that people who are optimistic may take steps to ensure the positive quality of their futures. In fact, more you are optimistic, the more you'll be able to remain relaxed because you have a hope that you will be able to do better. The beneficial effects of optimism and positive coping skills have been shown to enhance one's ability to deal with the stress and depression. Seligman reported that optimistic people experience less depression and they also experience increased enjoyment in the social interactions. I think they have more aha moments than anybody else. This is due to their ability to expect positive future outcomes based on positive past experiences. Several studies have reported a strong relation between an optimistic outlook about the future and happiness. Pessimism about the future is linked with depression and hopelessness. In one study, Harju and Boleyn studied the effects of optimism on quality of life of college students. The results found that the high optimists rated themselves as having the highest quality of life and more effective coping skills. And we know that the coping skills are the most important way to determine our successes and failures and even happiness. Optimism, pessimism, and coping. Differences in coping methods used by optimists and pessimists have been found in a number of studies. In their study, Scherer, Weintraub, and Carver asked the students to recall the most stressful events that they had experienced during the previous month and to complete a checklist of coping responses with respect to that particular difficult moment and the event. Optimism related to problem focused coping, especially when the stressful situation was perceived as controllable. Optimism was related to the use of positive reframing and also with the tendency to accept the situation's reality when it was perceived as uncontrollable. So, accepting the situation's reality is important. In contrast, optimism related negatively to the use of denial and distancing oneself from the problem. Now, distancing oneself from the problem and denial are the negative and poorer ways of coping. Thus, optimism is related with the positive ways of coping. These findings showed that optimists use more problem focused coping than the pessimists. They also use a variety of emotion focused coping techniques but in a positive way. Hence, it can be said that optimists have an advantage of better coping over the pessimists who show the poor coping in the similar situations when these are perceived as uncontrollable. Optimists also report a dispositional tendency to rely on active problem focused coping. Pessimism is related to the tendency to disengage from the goals with which the stressor is interfering, while optimists report a tendency to accept the reality of stressful events. They also report trying to see the best in bad situations. So, seeing the best in the bad situations is important. In contrast, pessimists report tendency towards denial and the substance abuse strategies that reduce awareness of that problem. Thus, optimists appear generally to use approach oriented coping strategies, and pessimists tend to use avoidant coping strategies. In this era, when we are running towards meditation, etc., for being aware, these studies indicate that optimism itself is an integral characteristic that makes you aware of the problems. In the workplace, optimists use more problem focused coping than do pessimists, like self control and directed problem solving. Pessimists used more emotion focused coping, such as escapism and using social support. In studies of AIDS patients, also, optimism has been found to be related to active coping strategies. Optimists have positive attitudes, they plan for recovery, seek information, and reframe bad situations in terms of positive aspects. Optimists use less fatalism, lesser self blame, and lesser escapism, and they do not focus on the negative aspects of the situation. Optimists also accept unchangeable situations rather than trying to escape. They face them. The coping responses related to optimism and pessimism is also related strongly to the distress. Positive reframing, acceptance, and use of humor all are related inversely to distress before surgery and after surgery. Hence, the relationship between optimism and coping is quite clear. Optimistic people tend to display more effective behavioral and cognitive strategies for dealing with stressful situations. Optimism has been linked to positive coping styles that include active, planned, and problem focused coping. As levels of coping go up, so does the enjoyment of the social relationships and the resistance to the stressful situations, and in fact the self-confidence and the capabilities to self-regulate and control the situations and the behaviors, etc., etc. Optimism and health behaviors. Optimistic people are healthier and happier as mentioned above. They cope better with stress using more effective coping strategies. They also actively avoid stressful life events and form better social support networks around themselves. They have healthier lifestyles which prevent them from developing illness. Even if they develop illness, they adhere to the medical advice better and follow through with lifestyle and behavioral patterns that promote the recovery from that particular disease they are suffering from. Optimism in early adulthood predicts health in later adulthood over periods of up to 35 years. Many studies show that optimists report more health promoting behaviors than the pessimists. Optimists have lesser illness and recover more quickly than the pessimists. Optimistic employees are more active, healthier, and happier. Optimism also has been associated with better physical health. Dispositional optimists report better physical health and report better quality of life after surgery. Well, I must say that optimism is dispositional, but it can also be developed and one can modify oneself to develop it. The route by which optimists might be associated with better health is through the effects on the immune system. Optimists cope differently with stressors, as discussed just now. They experience less negative moods and may have more adaptive health behaviors. All this could lead to better immune system functioning. Learned helplessness, on the other hand, weakens the immune system, which is a characteristic of the pessimistic people. T cells no longer multiply rapidly, and NK cells lose their ability to kill the foreign invaders amongst the pessimists. Optimism and work performance. The explanatory style theory says that in order to choose people for success in a challenging job, hirers should take into consideration three characteristics: aptitude, motivation, and optimism. Working with Metropolitan Life Insurance Company, Seligman studied optimism in the insurance agents. He found that life insurance agents were highly optimistic. The more optimistic half of the agents studied sold 37% more than the pessimistic half. The most optimistic 10% sold 88% more than the most pessimistic 10%, and that the pessimistic half was twice as likely to quit in the first years itself. So their perseverance is also lesser, persistence also reduces. After 2 years, the optimists in the regular group of the hires outsold the pessimists by 31%. Amazingly, however, the special hires outsold the pessimists in the regular force by 57%. In another study, McCall, Kennedy, and Anderson found that frustration and optimism fully mediate the relationship between leadership style and employee performance. One early measure of optimism and pessimism was the life orientation test. The life orientation test consists of 8 coded items plus some filler items. Half of the items are framed in an optimistic manner and the other half in a pessimistic manner, and the respondents indicate their extent of agreement or disagreement with each item on a multi-point scale. The life orientation test has good psychometric properties. However, it was criticized because the optimistic and pessimistic item sets form two factors that are not always strongly interrelated. The LOT was superseded by Life Orientation Test Revised, or known as LOTR. The LOTR is briefer than the original, 6 coded items, 3 framed in each direction. The LOTR has good internal consistency and is quite stable over time. Given the above mentioned considerations, the LOTR is preferred over the original LOT. Both the LOT and the LOTR or revised provide continuous distributions of the scores. Distributions tend to be skewed towards the optimistic but not greatly. People range from being very optimistic to very pessimistic, with most of them falling somewhere in the middle. The Attributional Style Questionnaire or ASQ is the most commonly used assessment tool for the adults. This self-report questionnaire contains 12 hypothetical situations, 6 negative and 6 positive. For each scenario, the participants are asked to imagine the event happening to them and to decide what they believe the main cause of the situation to be. The respondents then have to rate these causes along the dimensions of internality, stability, and globality. To complement and to compensate for the ASQ's limitations, the content analysis of verbatim explanations technique was developed by Peterson, Shulman, Castellan, and Seligman. This procedure involves assembling a sample of written or spoken material from a person, such as letters, diaries, interviews, etc., which contain the statements about the person's explanations for negative outcomes. Then these statements are analyzed in terms of attributions made by these people. Other measures of optimism are the Generalized Expectancy of Success Scale, or GESS, by Fibel and Hale, and Optimism Pessimism Scale, or OPS, by Demberd, Martin, Hammer, Ho, and Melton. In the end, now to summarize, optimists are the people who expect good things to happen to them, while pessimists are the people who expect bad things to happen to them. The concepts of optimism and pessimism are related to people's expectations for the future and are related to the expectancy value theories of motivation. Dispositional optimism is defined as the global expectation that more good or desirable things than the bad or undesirable things will happen in the future. The explanatory style's approach to optimism relies on the assumption that people's expectancies for the future come from their view of the causes of the events in the past. Optimism is related to higher subjective well-being, problem-focused coping, healthier lifestyles, and better work performances.